arthritis and things like this. We only had one at that time before I left, and it was not very good. But when I came back, I'm telling you, we've got some new things that are amazing. And really, this has occurred over the last 5 to 6 or 7 years. It's not even 10 years ago when all this has come about. We have drugs right now that will totally cure psoriasis. Now, it can come back, but it's a safe drug. And if you have patients, I do a free clinic up in, well, we were in Gadsden yesterday. We try to do it once a month or maybe every 2 months. And we had a patient up there that we had seen. She was, totally covered with psoriasis. Horrible disease all over. It was on her face, on her head, it was everywhere. But we had put her on one of the biologics. I saw her yesterday. She was totally clear. It's just amazing. And some of the medicines now we're finding will cure other things, even though the FDA has not approved it. There was a disease called bullous pemphigoid that I see fairly frequently. A blistering disease, like Job had in the Bible. These patients, I read an article, a little article, that said they had one patient that they had treated with Dupixent, which is one now we're using for eczema and for asthma. And it had cleared that bullous pemphigoid. Well, this hadn't been approved by the FDA, so I had this patient who was diabetic. I couldn't give him steroids, so I said, I'm gonna try you on this. Totally cleared. And now I'm treating, even before it's been approved, just been approved by the FDA. Before then, I had 4 patients that I was treating with this particular medicine, and it had not been approved by the FDA yet. Because you can use off-label, you can use medicines off-label, and that's what we were doing. But everyone cleared completely. So we're seeing things now that we just haven't seen in years, or ever. And the thing now that's coming down the road is AI. And I think that may affect you also. So you kind of got to get ahead of it. If you don't embrace it, it's going to run you over. And, it's going to take over, what you're doing. We use AI in our electronic medical record systems. Now, do y'all use electronic medical records? Okay, all right. I hate electronic medical records. All right, I always have, because 2 or 3 things. Number one is the record is not real good, and number 2 is in medicine they're not real accurate because you have templates that you move over here to cover certain things, and folks, it's just a word salad. And if you try to read electronic medical that's sent to you from another doctor or the ones in our system right now, you can't learn a whole lot. They're just not accurate. Now, but they have some good points. You can phone your medications in on your electronic medical records, and so people don't have to read your writing and all that. It goes directly to the pharmacy. You can send them quickly to other doctors. You can send them to other people that want copies of the records. But they still are not good systems. I give you an example. 2 or 3 years ago, I had a consult at the hospital. They wanted me to come over and see this patient who had a bad blistering disease. And I went over and I examined him. Sure enough, he had the bullous pemphigoid that I was talking about a few minutes ago. And so I tend to always examine the patient, talk to the patient before I go and read somebody else's notes. And so then I went and read the note of the person who admitted him. And as you go down the note, it has a review of systems like ears, eyes, nose, and throat. That's part of your history of physical. But down at the bottom, it says skin, normal. This guy was covered by 1,000 blisters all over. Okay, and on the records it says skin normal. That's just an example of how inaccurate some of these records are. What we're doing in our office, we're going to use AI. What we're doing is through our electronic medical record system. What we're doing is it listens to what I say as I walk in the room, and as I talk to the patient, and the patient talks to me, and everything that we say in that room is recorded. Now, the extraneous stuff is left out in the final note. You know, if you talk, you say, did y'all go fishing yesterday, or how's your mom and daddy, or, you know, all this, that's all left out. But it's in the note. I see it before I finalize the note. But what it does, it records what the patient says, and it records what I say. The good thing about it is this: the record is going to be better, it's more readable, and when you send it to other doctors, or the patient wants it, they can read it, and they can understand it better. It doesn't have a bunch of word salad in it, you know, to cover all the other, to cover everything, really. But the other thing it does, which is important for me, and I think it's going to be important for physicians and people who don't take time with their patients, it makes you do what you're supposed to do. It makes you examine the patient, and you have to talk about it. And as you say, I'm examining the head, and I don't see this, or I see this on the head, or I examine the skin on the left arm, they've got a red, so, you know. But it makes you talk about what you're doing, and it's a more thorough examination. You're spending more time with the patient, and you're going to do a better job, and it's going to be a better record. So we're working with this company, trying to refine it right now, and I think it's going to work. I think you could use AI for the right thing. And I'm sure that y'all are seeing what's coming down the pipe with y'all's specialties. And AI is going to be a part of that. But y'all going to have to embrace that and be a part of it too. There's some great things with AI. But if it's not done correctly, and it's not done ethically, you know, then we're not on the right track. You know, some of these things, when I hear about what is happening, y'all know what Neuralink is, don't you? Okay. To be able to, through the brain, bypass an area where you have paralysis and be able to walk just from the brain, bypass that's amazing. So we don't know what's going to happen down the road. And there may be so many things that will help patients that, it's exciting. I wish I were going to live 30 more years so I could see some of this. I'm not, but you know, it is amazing to think that what we're going to have through the electronic medical, through the AI systems and what's going to help y'all, and it's going to help us too. Now, let me talk about one or two more things before we stop. You know, it's really when you're working with people and working with patients, it's really the small things that matter. It's the small moments that you have with the patients. And it's talking to them. It's when you enter the room and you smile at them. They kind of relax. They're nervous. They're hurting. They have problems, but you help them to relax and make them feel like you're here to help them. So it's just these little things that people really enjoy you doing, and it just helps the patient. You know, in 2010, when I was running for governor, I was campaigning up in North Alabama. And I went to a manufacturing plant up there. And so as I went through, and they let me go through and shake hands with people and ask them to vote for me. And so I was going through, and I went to this lady, and she looked a little bit familiar. She said, Dr. Bentley, how you doing? Well, she knew who I was. And I said, well, I'm fine. I said, I think I know you, do I? She said, well, I know you don't remember me. But she said in 1977, in October, the first week in October, I was a college student working 2 jobs down at the university, and I really got sick. I had this terrible rash all over me, and you took me as a patient. You took care of me. You got me better. In fact, you completely healed me. And she said, when I went up to the window up there after 3 visits, I knew I didn't have any money, but I was going to try to pay a little on my bill. But she said, when I went up there, the lady at the front desk said, well, your bill has been taken care of. And I didn't charge her, because I knew she was hurting financially. She was in school trying to get, pay for all this. Now, I didn't remember that. I didn't remember her. But she not only remembered it, she remembered it since 1977, and she knew exactly the date it had happened on. And you don't think little things like that, they're indelibly etched in your brain, and you just never forget. I mean, she still has never forgotten that. And I have patients I had a patient last week that we were seeing that told me the same kind of story. 35 years ago, I had done such and such. Now, I know when you're running a business, especially if you work for somebody or if you have to buy something, you can't give everything away. But occasionally, you can do certain things. And even if it's just the way you treat people, it doesn't have to be money. You might say, well, let me help you find somebody that'll do this or that to help you. Just the little things. The little things matter. And that ethically is an important part of our practices. So let me leave you with this. We chose these professions to go into. And, I look back on my life as far as when I went to medical school, and I didn't have any money either, and I didn't think I was going to get in. But everything worked out. And of course, I'm a Christian. I prayed about it, and I felt like that this is what the Lord wanted me to do, and obviously He did. And everything went right. And all of you, and I'm the same way. We chose a profession that touches the lives of patients at the most vulnerable points. You help people walk again, or work again, or live again with some confidence and with purpose. But ethics is not a burden, it's a compass. It's what guides us back to the patient when our systems kind of pull us away from the patient. It's what turns procedures into healing. It's what turns knowledge into wisdom. After 50 years in medicine, I'm convinced of this. The best clinicians are not those who necessarily know the most, but those who actually care the most, intelligently and consistently and ethically. Ethics begins right here. All right? It doesn't begin when you take boards. It begins right here, and it's in your mind, and it's in your heart. So that's where ethics begins. That's where you have to nurture it. That's where it ought to always stay. Ethics begins here, and it's our purpose in life, serving others, that ethics continues to permeate here. And it continues to support us. And you know what it does? It makes our work, when we're serving people, a sacred work. So when you help people, I know that you enjoy doing that. I enjoy doing that. It's important because we're placed on this earth to serve other people. And we need to do that in everything that we do. And I know y'all do, and I do the same thing. So let's remember what ethics really is. It's not law. It's not all the things that you have to do. You just have to do those in order to practice. But ethics is how you treat people. And I know you do the right thing, and I'm going to try to do the right thing. And I appreciate y'all letting me talk to you.